We have, for the last 20 minutes here today, we have a panel with 3 very competent speakers. 2 of them have been on stage already. So please, can I invite you to give a round of applause to Juliette Legler, Rolf Vermeulen, and Leo Chasande.
And thanks, especially Leo, who came over and actually dressed up in Aurora blue, as I just realized.
Good. And we will share microphones, apparently. So just to give you a quick introduction, before we'll get to your question, I promise you we'll get to that. Leo Chasande is, and I want to read this, so he is a human being. He's exposed to microplastics. And he's the Jim G. Hendrick Medical Doctor, Professor, Director of the Division of Environmental Pediatrics and Vice Chair for Research in the Department of Pediatrics at New York University School of Medicine. He also serves on the faculty of New York University Wagner School of Public Service and the New York University College of Global Public Health. And Langone, did we miss that? Or we don't have to mention that? Langone is the parent of all of those. Great. Wonderful. So thank you so much, Leo, for coming all the way from New York to be with us. Some of you, probably not anyone other than me, watched the recent announcement by the US Health and Human Secretary and the EPA head, Lee Zeldin, and RFK Jr. on the microplastics research program in the US, and you made some very, very good comments there. So you also work on micro nanoplastics. Would you like to field this question on what are the chronic effects of micro nanoplastics exposure, considering that they have persistence? One could maybe call them not forever chemicals, but forever materials, right? What are your thoughts on that? Why are we not addressing that?
So is my mic on? Okay, great. First of all, delighted to be here. Dankjewel. And I'd begin by saying that when you think of placental biology, you have to think of an organ that's intended to stay functioning for 40 weeks. And in many ways, the 72-hour exposure is but a snippet of a broader phenomenon. It's almost as though we're thinking of gestational age 0 to 72 hours. So defining what is, and that's in the context of the fact that micronanoplastics exposures are continuous, just like chemicals from plastic are continuous exposures. So I would almost use the perspective of continuous low-level exposure as the frame in thinking about your question. So it's not to me as much of a chronic effect from an acute exposure or single time point exposure. It's really the continuous low-level exposures that are not the basis of this study. What little we know about placental biology is that many toxicants in many ways, a lot of your earliest career is on air pollutants and their effects on a variety of organs. But we know that particles wear down the placenta just like chemicals do, not to mention dietary and other naturally based oxidant stressors. They all wear down the placenta in a way that at some point, either the membranes rupture, the vascular tree has bleeding, it has clots, it has complications, pregnancy-induced hypertension really originates in the placental biology as well. And so I don't think we have the answers from this study, but we have signals from other studies that suggest chronic exposures have effects on other organs. I don't know if there's a true notion of chronic placental effects. So I'm just being precise about language here, because I think what we're really talking about is in the placental context in the studies presented in Aurora, that we're really talking about continuous exposure for a 72-hour period. And one of the next steps of research might actually be continuous exposure at various levels, probably lower levels based on what we know to have been null thus far on placental biology.
Okay, I have two quick follow-up questions. Quick question, quick answer.
Sorry
First,
for the model.
no, it's all good. We want to hear you. That's why we brought you here. But two quick follow-up questions. First of all, are we testing chemicals and materials right now the way we need to be testing them in order to determine impacts on placenta? And anyone can answer that. And the second question is, do we feel that chemical risk assessment is actually preventing chronic diseases? And what's what's the status quo on chronic diseases right now? And any one of you can take that.
So I may have okay, so that's much better. First of all, my facial expression probably wasn't too visible to the online people. I didn't mean to laugh at the question. I just laughed at the magnitude of the question you're asking in many ways.
Big questions only today.
Big questions only, wicked questions at that. So I don't think we know what the effects are we have not fully unraveled. We know that there are suggestive effects of plastic chemicals.
But are we testing these chemicals?
Are we testing them properly? Hell no.
Good. Anyone else want to chime in?
Technical term.
I think I might want to answer your second question about are we doing well enough in chemical risk assessment to address disease?
Yeah.
And I don't think we are. I think I've been studying obesity and diabetes for quite a while now as a multifactorial disease that is where environment and chemicals also play a role. And we're not yet at chemical risk assessment is not yet at the stage that it actually recognizes those diseases as something where chemicals do play a role or where there's adversity through chemicals. It's needs to be developed and needs to happen. Our testing strategy using animal studies is looking at toxicity effects in the intact organism or in the offspring that are not, predictive of disease. Not yet, but it's on the table, I think.
I just want to pick up the challenge that Leo put out when you said, okay, I mean, I do a lot of air pollution research as well. And so I think we can also reverse the question, and that is say, okay, by analogy, what can we infer? And so we do know for air pollution and particle exposures that reaches the placenta, that does have documented birth effects when we think about air pollution. So you can reverse the question and say, okay, is there any reason to believe that micro nanoplastic particles do something different than the particles that we already know? I have no evidence to suggest that that's the case. So by that, I would argue that what I know about particles is that they do have an effect and that there is something going on. The same I can say for plastic chemicals. If I think about phthalates and others, we have very good epidemiological evidence that they do affect the early life. And so again, if I then revert that back to, would I have to assume that if those plastics are in plastic products and leach out or not, have a different effect? No, I have no scientific evidence to argue that that's not the case. So, so to reverse the question and say, what are we uncertain about? I'm pretty certain about a few things that when we think about particles, when we think about the chemicals, that there are really documented health effects. And so by there, that might also be the question to Nerea, is that a clear hall pass for if we don't find toxicity? No, because by extension, there's a lot of evidence there, not specifically for the plastic contaminants.
Can I come back in? So I couldn't agree more with your point. I think where Jane was going to some extent is what information would help guide us to, just bear with me when I say this, to develop and use safer plastics. I think there's a pedagogy out there that we should just reduce plastics and the story would be over. You may guess, tend to take the approach that we are going to need a glide path if we want to go in that direction, to go to safer plastics in addition to reducing plastics. But we can debate that over Bitterball and beverages afterwards. But to your point, the reason I said hell no is that there are 10,000 chemicals, Jane, you said, for which we don't have any information whatsoever. So, just using placental biology as an example, if we had hazard data for estrogen, I'm going to be oversimplify the placenta, estrogen, progesterone, let's throw an oxidative stress for fun, and testosterone, let's say.
Mitochondrial health?
Mitochondrial health would be, I think, totally in scope for placentae as well. What 10,000 chemicals with no toxicity testing tells you is there are no data, period. That simple level, which is almost an extended version of the EATS platform, estrogen, androgen, testosterone, and what am I missing? Steroids, but yeah, steroidogenesis. Sorry, that the jet lag is hitting me, and so that's a little bit of an extended EATS. I'll give you steroidogenesis for $500. Why not? Let's add it in, but that would be a huge advance if we had data on the 10,000 for those. And now I'm just talking about we could do ToxCast kind of testing methods or high throughput methods to do that. And I wouldn't say that would be complete. I would still give Jane a no, or not, maybe not hell no. The hell no would be, I'm alluding to what might be a minimum bar.
Okay, great. So I was thinking about how to compare this microplastics exposure. And we've had air pollution. Now, a special kind of air pollution is smoking. And so just want to take us back to the 1956 doctor study. I believe it was 1956, right? I'm looking at you not because you were around then, but because as an epidemiologist, I am sure that you have studied as much as you can study about this case. Can you tell us briefly about that study and what can we learn from that for our work on micronanoplastics? And I'm thinking here, Roel, about levels of exposure, because this is something that I've been hearing a lot from people. Oh, we can't say anything about the health impacts and the risk of micronanoplastics until we have certainty of what are the actual exposure levels. We need certainty on the exposure levels.
Right. So I was not thinking about the physician health study when I came in here, but it's good to reflect on that. The first evidence was on smoking was basically comparing physicians that smoked versus that didn't smoke. It was a kind of a yes-no comparison to see what the difference in risk was. It was not because there was a very accurate assessment of how many cigarettes were smoked, let alone what actually the constituents of cigarette smoke was. That evidence that actually was produced in that study was right, did identify the risk correctly. And until now, we can have discussions about what in smoking is actually causing exactly lung cancer via which mechanisms, which frankly, we still don't know exactly how that worked. So we don't need that level of evidence to actually have the first insights. The same is true when we think about air pollution and natural mortality. The first study that was done in the 1970s in the US was done by placing one monitor on the post office in 7 cities and compare the disease rates between those 7 cities. They derived an exposure response curve, which currently up to today is still quite accurate and close to the dose response curves that we actually get now with much more detailed measurements, with much more detailed monitoring. The point that I'm trying to make here is that let the perfect not be the enemy of the good. I think what is happening in a discussion about analytical methods is that we actually saying, I have to know exactly which micrograms that are there of which polymer. From my standpoint as an epidemiologist, what I now want to know who is high and low exposed so that I can compare them. And if I actually then can compare the disease occurrence in those groups, that is solid evidence. And I would argue that the techniques that we have today are good enough to actually make that broad classification. And so that is a different answer than, well, that's the answer that I have for you. And I think it's important to actually differentiate that and take also the historical perspective, how we actually got to the evidence of things that we are absolutely certain about.
Exactly. And maybe just to add here, the end point, so to speak, as we say in toxicology, that they looked at in that study was, what was it? Cardiovascular, right?
For the physician, well, actually, it's even more interesting. The study was actually done to actually look at air pollution. And so smoking was not the primary analysis in that study to begin with.
Didn't know that. Okay, great. So I think I surprised you there with that question, Roel. I want to hear from you two. What surprised you today? Sitting here listening to these talks, or maybe also, Juliette, you've been part of the Aurora project for 5 years. What took you by surprise? What did you find? What did you find the most interesting or disturbing or just, you know, surprising moment?
I don't think I would call it a moment. It was sort of a gradual realization that this field is so complicated. I think that surprised me. I must have been so naive when we started coming from the chemical field, you know, thinking, you know, like I said earlier, we could get our hands on 100 different particles and we had some preliminary data of micro nanoplastic signatures in placenta, and we thought in no time we would have 800 samples analyzed, and we thought we would just be able to dose our cells with these plastics, and everything was so complicated and so much more difficult. And I think the PhDs in the project sometimes were ready to stop. And it was such a fantastic interdisciplinary project. We really needed each other's expertise to understand how to move forward, but it was slow and painstaking. And yeah, that was surprising. And if I may, a second big surprise has come now at the end of Aurora, and that has to do with the European call that our colleague from JRC just put up on the screen. I was really surprised that I think, and I'm not entirely sure because it's all anonymous, but I think none of the CUSP clusters, none of the CUSP participants are carrying forward in the next round of proposals. And I'm like, that is so surprising to me because it took us 5 years to get where we are now. And I really hope that the next projects don't have to start from scratch again with people who have never worked with micro nanoplastics before. And I hope that there's some sort of connection between CUSP and the new cluster so that they don't take 2 or 3 years to start over. And so,
yeah. So really it's the communication challenge again, in a way. So this time with the target audience being within the project, but from different disciplines. And I think in addition to the experience of how to research micro nanoplastics, one of the things that we have built within CUSP, which now obviously is getting lost, is this human connection, because that also took us quite a while, right, to get up to speed, to collaborate and find a way of how to work together, and in the end produce this roadmap, but many other outputs as well. So maybe that's a lesson learned as well that we should somehow capture, or we're capturing it now.
Are there any plans to keep on going in the next round? So maybe I could bring that back to our European official, you know, if you can put any influence on, are there any other European officials in the room? Yeah, no, wonderful. To really make sure that this.
You don't have to. I mean, we put you on the spot here.
Just to make sure the community stays together somehow, and the knowledge is transferred to the next, you know, group of fantastic researchers who will pick up and go forward.
So for sure that the new proposal that we will move forward in the second stage will have to go beyond the state of the art, meaning that they will have to uptake all the results of the CAS that will be available and in open science and in open source. So that's the hope, that the ones that are going beyond the state of the art, is the one. So that's my hope. That's happened. So, and I hope that all the results and all the roadmap and all the scientific publication are uptaken, and as all the.
Yeah, and I think, I mean, this is.
Thanks, Nerea.
Yeah, thanks, Nerea. I mean, there's also basically, I think, I mean, what we saw is basically that's a huge interest in micro nanoplastic research now, and there's many groups basically focused on this. And in essence, this is a good thing. It actually means that there's a lot of people actually focusing on this topic. And so I think the fact that the last call was so successful in getting applications in, we can see as a good thing. There is also basically then how do we transfer knowledge to the other research projects that will continue. And I think this is more a scientific community issue that we always have. And that is, of course, that what is in publications is only the tip of the iceberg of the experience. All the pain that Juliette and fun, but also a lot of pain that we had to actually get these methods to get to where we are. Took basically more than 3 years before we had anything. That's also where I think Juliette was referring to our PhD students, because there was really nothing basically in the first 3 years that was easy or that actually panned out or that didn't look like something was wrong. That is not in the papers. And so whenever we start, there is a learning lesson that, of course, you can speed up, but that needs to be transferred. And I think that is open science. And open science means that this is also the invitation of Aurora to the rest of the community. We have that experience, so please reach out. And there is a lot of data, a lot of things that we can do together, but do it together. And that is not only up to us, that's also up for the other ones to do so. And we are certainly open.
Okay.
So
Mia, what surprised you? Real quick, because Justin's
Oh,
giving me the sign to wrap up, and I have one more question, just a real quick one. Okay.
Oh boy.
So,
So first
keep
of
it
all,
tight.
I want to applaud and reflect yours and the respective CUSP teams in that you have blazed a trail for a large group. You're part of the momentum that has brought the public awareness, also aligned with reality. And I would just suggest, this is an unfunded mandate to suggest, but writing up your lessons learned, because you're not just talking to the EU collaborative for the next round. You're talking to ARPA-H, which is putting in $144 million down for a future trajectory of research. There are other places besides the US and Europe that do research as well. So what surprised me the
that
most?
was closed last week. We're a bit late for that one.
Well, that's a bitter ballin discussion.
Okay, good.
But what surprised me the most? Polyamide didn't surprise me. It's the lack of signal from the other micro nanoplastic types. There's a big asterisk there, because we don't know whether conditions of food contact, of biological systems contact, further environmental weathering, further weather those microplastics to make something biologically active in the micro nanoplastics. What I also think might be a message worth sneaking in there, because I think it has to be made clear to the general public who thinks of plastic and they think of micro nanoplastic as the vision of plastic, is to really emphasize the need for study of the especially the 10,000 chemicals used in plastic that are not tested, and the joint effects of chemicals coexisting with micro nanoplastics, which are big areas. And I appreciate I've blown some stuff up because others are chiming in.
Yeah, so I mean, just to summarize again, it's not just the type of plastic, it's the size, it's the shape, it's the chemical composition. Yes. And then also, of course, we get these surface effects from the weathering. So are there bioorganisms, biofilm, charges, positive, negative, all of that will impact. Okay. Roel, real quick, and then final question.
Oh no, I just wanted to say that within the human study that we have done now, we have measured the micro nanoplastic by pyrolysis, but also have done untargeted high resolution mass spec to actually measure over 700 chemicals and have done alkaline assisted LCMS to actually get to the monomers and to the bounded chemicals. So this will be the first data set that actually goes across basically from mass-based plastics to the free chemicals to bounded chemicals. And again, it's going to take us time to, and that's not pun intended, digest the information that we have there. And again, we are very open to anybody that actually wants to delve into these high complexity of data, because no one has actually ever analyzed such data. So it's not going to be trivial how we move that forward. So again, this will be there, and that's a resource that other can tap into as well.
Okay, good. So we are coming to our end of the final event. And obviously for us Aurora people, it's a special moment. So I want to thank you already now for joining us here. And I think one of the things that I will leave with today is how many more questions there are. But that's exciting, right? As researchers, I think it's the worst to kind of think, oh, okay, this field is dead. There's no more work. This is not the case here. So inviting you three, and you can think about it for yourselves also, to just indulge the thought, engage with the thought right now. If you had a magic wand and you could only use it for research, right? What data would you want to create? Like just with the flick of the wand. I didn't prepare them for this. You see, this is
I think I already gave Jane. I think I already gave one, so I'm not going to give it. The 10,000 chemicals is a layup
but
question.
what specifically? What do you want to know about those 10,000 chemicals?
I'll take an EATS panel plus
Okay.
maybe oxidative stress for
So
200.
For all the known plastic chemicals, 16,000. I keep.
If we had it across all 16,000, that would guide prioritization. Now that's an oversimplification on a number of levels from disease systems.
Okay. Good.
For me, it's the first high quality human study, and we might already have it, but I don't know. So that's really what we have to look into. And that's not that I wanted to make a joke of that, but it is because the complexity is so high that to understand exactly what we have is hugely difficult. And I hope that others will follow suit so that we actually can build that evidence base up. That's how we have moved forward on many other environmental stressors. This needs to happen, and we need to figure out how we get there, but also that we then reflect on it with a positive mind into the scientific community, that we actually read and reflect on the others in a positive way so that we can actually move it forward and not in a agnostic way.
So basically you want to know what types of polymers are people exposed to and at what levels?
I actually want to be able to bin them in a group that is low, you on the left side, or a bin that is on the right side, and that would already be an excellent beginning point for me.
Okay, great. Thanks for clarifying that. Juliette, you get the final word.
All right.
Final wish.
As a toxicologist, I could probably think of lots of different tox studies, but maybe just as a human being, I think I would wave my magic wand and want to know which plastics we definitely need to keep in our lives and which ones could we get rid of, this essential use idea, and what would be the first ones we could get rid of, and how could we really all reduce our use of plastic.
And I'm sure you've all also thought about yours. I'll share mine with you as well. I would like to figure out, how do we get people to care about this? That would be my wish. Okay, and with that, I guess we are wrapping up. Would you like a final word? You get that as the coordinator of Aurora.
I
Otherwise, I would invite our colleagues also to.
I don't want to have the final word, so I'm just gonna
Okay.
look at either Amanda or Lawrence, which are two young researchers within the project, to actually end this meeting, because they are the one that actually will take the torch forward. So sorry to put you on the spot.
Do you want a final word?
Yeah, shall I give it a shot? So I started in Aurora as a postdoc. I'm now assistant professor, and as an analytical chemist, I was struck by the fact that interdisciplinary science is complicated, knows many burdens and challenges, but is also, in my opinion, the only thing that will give us any reasonable answers on the major challenges that we are facing. So that would be my final gist.
Yeah, we all need each other. And it definitely took all of us to get to this point in the project. And when you're working with such an open and collaborative group of scientists, that makes the experience so much more joyful. So let's all embrace each other, share our scientific ideas, and take the research field forward together.
Wonderful. Thank you so much.